Today we will discuss about the structure deep inside the neck, deep to the digastric triangle. Here you can see this is the anterior belly of digastric, this one is the posterior belly of digastric, and along with it there is a one muscle, it is the styloid muscle. This is the styloid muscles. Here you can see this is the hypoglossal nerve, and this hypoglossal nerve pass deep to the myloid muscle, enter inside the tongue, and it supplies to the muscles of the tongue. It is the 12th cranial nerve, and it also gives the branches of the C1, and it makes the ansa cervicalis. So here you can see this is the posterior belly of digastric, and this is the styloid muscles, and this is the level, this is a styloid process, and this styloid process basically gives the attachment of the three muscles and two ligaments. One, we have already reflected the mandible, that's why stylomandibular ligament we have already got it. But another ligament here you can see, this is the stylohyoid ligament. This stylohyoid ligament you can see, and this stylohyoid ligament, it is a remnant of the second branchial arch. And another muscles which is coming from styloid process to the glossus tongue, and that's why it is called the styloglossus. This is the styloglossus muscles. And deep muscles goes and enter inside the pharynx between the superior constrictor and middle constrictor of the pharynx. It is the stylopharyngeus. This is the stylopharyngeus, and along with it stylopharyngeus you can see there is a one nerve. This is the nerve you can see. This is a nerve which is deep to the it is a glossopharyngeal nerve. It supplies to the stylopharyngeus, and this stylopharyngeus and glossopharyngeal nerve which enter inside the pharynx between the, here you can see this is a deep to this styloglossus, you can see this is a hyoglossus as well as, and along with it there is a superior constrictor muscles, and below this posterior belly of digastric and stylohyoid, here this level, this is the middle constrictor muscles, and middle constrictor extend till up to the internal laryngeal nerve and superior laryngeal artery. Below to this portion of the pharynx on the back side, this is the inferior constrictor, this is the middle constrictor. So the structure passing between the middle and inferior constrictor, it is the internal laryngeal nerve along with the superior laryngeal artery. The structure below to the inferior constrictor, it is passes the structure, it is a structure below to the inferior constrictor, it is a recurrent laryngeal. So this one is a recurrent laryngeal nerve. Along with it there is a inferior laryngeal artery, and this is the branch of the superior inferior thyroid artery. It is passed along with the recurrent laryngeal nerve, and it is passes below to the inferior constrictor, and inferior constrictor have a two part. The lower part it is called the cricopharyngeus, and upper part it is called the thyropharyngeus, and in between the cricopharyngeus which is supplied by the recurrent laryngeal and thyropharyngeus which is supplied by the interlaryngeal. That's why there is a sometime incoordinations which occur, and it lead to there is a diverticulum which is occur in between food bolus which is come out, and diverticulum which is occurs. The interlaryngeal and superior laryngeal artery, interlaryngeal nerve and superior laryngeal artery passes between the middle constrictor and inferior constrictor muscles, and the last one between the this is the glossopharyngeal nerve. Along with it there is a muscle, it is the this muscle, it is the, along with the glossopharyngeal nerve, this muscles, it is a stylopharyngeus, this is a stylopharyngeus, and glossopharyngeal nerve enter between the, enter inside the pharynx between the superior constrictor and middle constrictor muscles, and above to this superior constrictor there is a muscles here at that level. Here you can see this is the internal carotid artery on the side view, And superior constrictor muscles, there is a structure on the side. You can see this is a internal carotid artery continues, but on that medial side you can see there is a auditory tube, and there is a one muscles which is the levator valley palatini, and there is a ascending branch of the palatine branch of the ascending pharyngeal artery, which is passes through the above to the superior constrictor and base of the skull. So there is a levator valley palatini, uh, ascending palatine branch of the ascending pharyngeal artery, and there is a auditory tube which is passes above to the superior constrictor. So these are the structure passes between above to the superior constrictor, between the superior and middle constrictor, middle and inferior constrictor, and below to the inferior constrictor of the pharynx. Hope you enjoy the video.